Here at University Hospital Southampton, offering the best patient care possible is the priority. My Health Record is a new online platform that puts the patient in control of their own healthcare and creates a better experience for clinical staff and patients.
My Health Record connects the patients with their health record. It's a website that's connected to the Trust website, but actually integrates then back into a whole infrastructure that's built on the Microsoft HealthVault environment. The HealthVault effectively gives the patient a single identity for potentially the whole of the NHS. That is a vastly different picture to what might happen if various websites spring up associated with each individual organisation.
My Health Record allows patients to interact online with their clinician. The patient can input a wide range of data into a centralised cloud-based record, which their clinician can access immediately. Data can be entered on a keyboard or directly via a healthcare device, such as a digital blood pressure monitor, and can range from specific medical readings to anecdotal information. Having access to this information will help clinicians with the co-management of long-term conditions, the prevention of unnecessary follow-up appointments, and gives us a better understanding of the patient's needs. Healthcare providers can also send data into the patient's record, helping to keep them informed of, for example, test results and upcoming appointments.
My Health Record is particularly going to help the young professional patients who are busy all the time. They don't have the time to contact their GPs. Their life work pattern doesn't fit with GP practices and sometimes our hours in hospital.
For the patient, I see big advantages in being able to share their information without a visit to the hospital, without all the difficulties of visiting and parking. And for those with easy access and to computers, just a few clicks away is the ability to share what's happening to them on a day-to-day basis.
The patients are going to feel that they have a direct line to us. They're going to feel a lot closer to secondary and tertiary level care in the hospital, and they don't always have to go through their general practitioner to come through to us. So I think it's going to create a closeness between us and them, and that's going to include the specialist nurses.
You get to see your doctor every 3 months or so, and you kind of store up your questions for those 3 months. And I think the functionality of the programme means that if you are worried about anything, you don't have to wait an entire 3 months. You can message your consultant with any queries, and I found it really quite comforting to know that my doctor is essentially at the end of this programme.
My Health Record also has enormous potential as an educational tool. There are entire sections within the system that contain condition-specific information on areas such as patient diet and medication. The HealthVault platform that drives the system is cloud-based and will allow the patient to grant access to numerous healthcare providers, social services, or even family members. Healthcare providers can plug applications into this data, making it a patient-controlled repository for information sharing.
It's the type of detailed information that we often don't have available to us in outpatient appointments, and I think having that available through this kind of information technology is going to make their care better and quicker and more cost effective.
Well, I think the specific benefits for the medical and nursing and midwifery staff are the enhanced communication between the patient and the medical staff.
The patients will be able to take control of their own records, their own information, and it all belongs to them, but it's accessible by us. And an example of that is a section where they can actually journal their own health, and this is something that we don't usually have access to, and patients don't usually report in that much detail.
Following the diagnosis of gestational diabetes, women have to learn about what is diabetes. They have to learn about taking their own blood sugars. They have to learn about the changes in their diet and exercise. And I think My Health Record could provide some really useful signposting, some video clips, and also facilitate them putting their blood sugars on the site so that we can respond and support them, support the women as needed.
We believe that My Health Record will improve the day-to-day running of the hospital, allowing for the sharing of data across multiple care providers whilst improving real-world patient information for the clinician and easing their caseload.
We're quite excited about the potential for the future of the project. It's really only bounded by people's imagination, and we feel that there will be a list of possibilities that will come out of the woodwork, if you like, as we develop onwards.
My health record will make both the patient's medical lives much easier and quicker and more convenient. And I also hope that it will make the clinicians' jobs a lot easier and again more efficient, which is part of the care that we provide.
My health records is going to make the sending and receiving information between us and the patients more slipstream and our lives easier.
I definitely feel more in control of my healthcare.